Yeah, I mean, addiction isn't that different than some of our other previously discriminated and shamed health issues, whether it be tuberculosis or breast cancer or HIV/AIDS. People shamed and blamed those people and discriminated against them, in those times for those issues. And so people with those illnesses would hide. And because of that societal shame, we hide. And for me and for many people, we internalize that societal shame as personal shame. Because if society's ashamed of me, then I internalize some of that personal shame. And I think that, anonymity plays into that for some people. Not for all people, but the idea that, okay, so I have this illness, I accept that I have this illness, I've been tagged with it, and now I'm in a recovery program, but I have to keep it a secret because the rest of society is ashamed of me, or I'm not allowed to speak about it. So it's a really fascinating social construction for a health problem, because we know that when people share openly about their health issues, they get the help that they need, and they get the ongoing support, and the community helps them. And so if people with this issue don't speak publicly, don't share with their community members about their needs and their wants to support their treatment and recovery process, we're not going to have the resources that we need, and we're not going to have a culture that embraces, empowers, and raises up people in recovery to achieve recovery. And we're going to have more of that shame, blame, lock up the key, throw them away. They're those people. And until we can get out of that, where those people box and we are everyone, that's really when we're going to see a fundamental shift in how we deal with addiction. So one of the most important parts of the film is about language. And we use the medical definitions for people with addiction culturally and socially is derogatory when we call somebody a drug addict, while medically it might be accurate in some ways. And so I would just consider the language that you're using in your program and the language and how that impacts your patient population, not only inside their treatment process with you, but also how that language disempowers them outside. And so it's not saying that 12-step language necessarily needs to change or anything like that, but think about language of empowerment. Think about person-centered language, somebody in remission from cancer, somebody, a person with cancer, a person with addiction. When we use person-centered language, we give back somebody's humanity, and our culture uses words like junkie and crackhead and drug addict and these words that really strip people from their humanity, and I think that providers often are in a position to really impart that empowerment-based language to people at a very vulnerable place in their recovery process. So I would really consider checking out the language on Many Faces, One Voice and thinking about the language that you use in your program.